So in this video, we're obviously going to be telling you about clinical interviewing skills, but we also will be showing you video clips that illustrate these. And we really hope that together they'll combine to help you become excellent clinical interviewers.
And we begin with a focus on very basic interviewing and listening skills. Skills that everyone needs to do a really good clinical interview. These skills include attending behavior, non-directive listening, directive listening and action responses, as well as the skilled use of questions. Later, we move to demonstrating more complex assessment interviews, including intake, mental status, and suicide assessment interviewing.
What brought you in today for the counseling?
Okay. This feels a little bit weird. I've never gone to see a counselor before, so I'm not exactly sure how to start, but I had a couple of, I guess what they called panic attacks. I went to the hospital for one because I didn't know it was wrong, and I was kind of freaking out. So I went there, I thought there was something wrong with me, and they said that there wasn't anything physically wrong with me, but I was having some anxiety issues, so they said to come here to the clinic.
So is it okay if I ask you a little bit about what led up to those experiences?
Sure. Well, a couple of them seemed like they came out of the blue, but I've been having some stress at school. I'm a second year at the university up here, so.
Yeah. So you had a couple of those classroom-based sort of.
Yeah. Well, the other one I was in like at a concert, like at a bar, and there was lots of people there, and I was kind of right in the middle of the crowd, so it wasn't at school, but it was kind of seemed like when there was a lot of people, it made me
just that crowded feeling, and then
like I can't get out, and I need to get out, and I can't get out.
Okay. What's the first physical symptom or thought? Which comes first? And
usually it's the chest heaviness.
So right
like
here.
I can't breathe. I, and then just kind of it feels like I can't get out, and I need to.
A traditional mental status examination includes about 9 domains. And the first 3, appearance, behavior or psychomotor activity, and attitudes toward the interviewer or examiner, are always just inferred. In other words, you just observe the client and then you make some inferences about those 3 categories. The remaining 6 categories are usually assessed in a little bit more of a direct way. And these other 6 categories include affect and mood together, speech and thought together, perceptual disturbances, orientation and consciousness, memory and intelligence, as well as reliability, judgment, and insight. Do you ever get any thoughts stuck in your head that just kind of go over and over and over?
I've got millions of those. Which one do you want?
What would be a typical one that gets stuck in your head?
Well, sometimes whenever something happens, I picture another event happening as a result of it, that gets stuck in my head. Songs get stuck in my head. Voices get stuck in my head.
Yeah.
They don't really belong to anybody. They just kind of sit there, and they used to tell me to do things, but now I get into arguments with them on occasion. It's
okay. So you have some songs that get stuck in your head, and then some voices that get stuck in your head?
Well, yeah, I like to make up the voices because it helps drown out the music. I mean, the voice thing is intentional.
Okay.
It helps get the songs and the thoughts and memories out of my head.
Okay.
So that's kind of like a self-help right there.
So one of the ways you get the something that's stuck in your head out of your head is maybe you sort of create these voices in your head, and they kind of
like an invisible imaginary friend.